Hi, Tejas. Can you hear?
Good evening, ma'am.
Good evening. Can you hear?
Yes.
I can hear you now. Okay.
Yes,
This
yes.
was a checking part.
Okay.
Okay, fine. Let me check my camera also. Hmm.
Manjunath sir,
Yes,
are you?
I am here. Can you hear me, Arun?
Yes, sir. Yes, I can hear you.
Yeah,
Yes.
right now I have not switched on my video. Do you want me to switch on? I'll just check once. Okay,
Yes.
fine. I think it's fine. For
Hi,
the time being, I'll
Tejas.
switch off.
Can you hear?
Hi,
Ma'am,
Dr. Kamlesh.
Good evening. Can you hear? I can hear you now. Okay.
Yes,
This was a checking part.
Okay.
Okay, fine. Let me check my camera also. Hmm.
Manjunath sir, are you?
I am here. Can you hear me, Arun?
Yes, sir. Yes, I can hear you. Yes.
Yeah, right now I have not switched on my video. Do you want me to switch on? I'll just check once. Okay,
Yes.
fine. I think it's fine. For the time being, I'll switch off.
Yeah.
Hi,
Ma'am,
Dr. Kamlesh.
Good evening. Can you hear? I can hear you now. Okay.
Yes,
This was a checking part.
Arun, can you hear me?
Yes, sir. I can hear you.
There is a echoing. Actually, whatever I said, it has come once again, twice. Therefore, I don't know why.
Yeah, I'm checking that, sir.
Should I log out and re-log in?
That's fine. I think it's my issues here.
Okay,
I think now it's fine.
I think so.
Yes.
Because whatever I spoke, after a minute's gap, the same thing came. I mean,
Actually, I'm live streaming this to YouTube, sir. Maybe from the YouTube voice it is coming. It will come 1 minute, delay in YouTube.
okay. Narsima has joined. Good evening, Narsima.
Sir, good evening, sir.
Okay. Oh, very
My
good.
voice is clear, sir.
Yeah,
Yes,
I
sir.
think.
Clear.
Thank you.
Arun, I will switch off my audio also. Okay.
Yes, sir. Yes.
Because
Sure.
then, whenever you need, just let us know so that I can. At that time, I'll switch on the audio. Okay.
Definitely.
Okay. Thank you.
Very good evening, one and all, gathered here on the occasion of 10th International Yoga Day. We, Inygma, Indian Naturopathy and Yoga Medical Graduates Association, as well as NITE Center for Integrative Medicine and Research, is co-organizing the webinar today. We are happy to uh, announce this webinar and happy that you all joined here, and we will have a small inauguration. For that, I request Dr. Dinesh Karta, President, Inygma Kerala chapters, to convey the welcome speeches here. Inviting you, sir.
Has Dr. Raghavendra Rao joined? Raghu is here?
I'll just check, sir.
Yeah, I think he has not yet. Maybe 2 minutes we'll wait.
Yes, sir. Sure.
Confirm that he is here and then we will start. Yes, Arun, are you here?
Yes, sir.
Hello.
I'm able to-
Yeah. Dr. Raghavendra Rao has joined, so we can start the program. Okay. First of all, let me thank all of you who have joined for the online webinar organized by Inygma and NITE today. As you know, we are celebrating International Yoga Day. The 10th International Yoga Day is being celebrated. Everywhere, the celebrations are going on and a lot of programs are being conducted. But when Indian Naturopathy and Yoga Graduates Medical Association, Kerala chapter, decided to organize some program. Hello. Yes?
Please continue,
Yeah.
sir.
Yeah. Okay. So when we decided to organize an event, we thought it should be something different. Everywhere, International Yoga Day is being celebrated as Yogasana Day. Yogasana celebration is going on. Yogasana practices are going on. And somewhere we can see in some places a pranayama practice is also there. But nowhere the scientificity of yoga is discussed. Nowhere the real medical benefits of yoga is being discussed. So that's why Inygma thought of a different direction and decided to organize a program, including speakers from different fields who have very, very vast experience in yoga as well as their own medical fields. So let me go directly into my duty. Today, I am here as the president of Inygma Kerala chapter to welcome you all to this event. And first of all, let me welcome Dr. Raghavendra Rao, who is the director of CCRYN, Central Council for Research in Naturopathy. Hello.
Namaskar.
Yeah, namaskar, Raghu. Thank you for joining us. And the CCRYN is coming under Ministry of Ayush, Government of India. And Raghu is a guiding light for the entire BNYS community. And he is actually a person who stimulates all of us to into action. And I welcome our dear Raghu, Dr. Raghavendra Rao, to this program.
Thank you, Dr. Gupta.
And it's a great pleasure that you have joined our program. And in the future also, we will be organizing such events. And please do support us. Yeah. And next, let me go into the resource persons of the day. Inygma Kerala chapter is really proud to present because we have got great and august speakers for today's program. First of all, let me welcome Professor Dr. Manjunath S. MD. He is the professor in physiology at Dr. B.C. Roy Multi-Speciality Medical Research Center, Indian Institute of Technology, IIT, Kharagpur. And his topic will be Science of Yoga, Research-Based Evidence on Yogic Practices and Effects. And a hearty welcome to you, sir, and thank you for joining us. Dr.
Thank you so much. It's my pleasure. Thank you.
Thank you. And next is Dr. Kamalesh K. Gulia, PhD. She is a scientist and in charge Division of Sleep Research Biomedical Technology Wing, Sri Chitra Tirunal Institute for Medical Sciences, Thiruvananthapuram. And her topic will be Yoga Nidra as a potential therapeutic tool for management of insomnia in elderly population. And as you know, both these topics are very relevant because the science of yoga, it is rarely being discussed in Kerala. There are, it's a very sad scenario that so many quacks are also into the field saying something like yoga therapy. They are practicing yoga therapy and they are doing so much of quackery in the field. I hope the evidence-based approach to yoga, it will definitely help to prevent such quackeries. And when coming to elderly population, the elderly population is really increasing in Kerala. And I hope Yoga Nidra will be helping the entire elderly population in Kerala. And thank you for joining us, Dr. Kamlesh. And
Thank
again, the next speaker is Dr. Venkata Lakshmi Narasimha, MD, PDF DM, and he is the Assistant Professor, Center for Addiction Medicine, Department of Psychiatry, National Institute of Mental Health and Neurosciences, NIMHANS, Bangalore. And his title will be Substance Use Disorders and Yoga. And thank you, Dr. Venkata Lakshmi Narasimha, for joining us. And you may be all knowing the substance use. It is really a big menace that we are facing in Kerala, and hopefully yoga can help, and it can be incorporated as a therapeutic tool in most of the organizations handling substance use disorder. And I once again thank you, sir, for joining us. And next, it is just as part of my official responsibility that I am welcoming them. But even then, Dr. Arun Tejas. Dr. Arun Tejas, actually, we can say is the backup battery for Inygma, the most active person. And I am really happy to say that as the Vice President of Inygma, his activities are really worth noticing. And he is the Assistant Professor and in charge, NITE, Center for Integrative Medicine and Research, and also the Vice President of Inygma. And I am very happy that he is the Vice President of Inygma and he is taking up such activities. And last time also we organized a yoga talk in Inygma talk. We are organizing talks on different subjects every month. And last time it was a big success. And this time also he was coordinating of the entire event. And today's program is also being coordinated by him. And I welcome Dr. Arun Tejas also to this webinar. Now, if he is the backup battery, we have got another inverter also. That is our dear General Secretary, Dr. Ansmol Varghese. So Dr. Ansmol Varghese always supports any activities of Inygma, and in whichever ways possible, he is supporting, and she is doing great effort to organize our events. And I welcome Dr. Ansmol Varghese also to the event. And finally, let me come to the audience. Today, we have BNYS doctorates, Bachelor in Naturopathy and Yogic Sciences graduates. Doctorates are there, as well as interns and students are there. And also some doctorates and students from the Ayurveda community is there because they have called me, and some of them have joined the, this webinar. So I welcome the entire audience who have decided to come along with the scientificity of yoga and to hear from the august speakers in the webinar today. So, and I welcome everyone once again, and thank you all. Okay, Arun, you can proceed with the next. Hello. Hello. Hello.
We can hear you, Karta.
Yeah. Okay, so Dr. Raghavendra Rao, I invite Dr. Raghavendra Rao to the chief guest of today's program to inaugurate the webinar being organized by Inygma Kerala. Please, Raghu, please go ahead.
Thank you, Dr. Dinesh, and I'm happy to see some good speakers who are here talking about sleep, talking about physiological effects of yoga, talking on substance abuse, etc. I think this is very much important, along with the celebrations we do on LDY, where we try to do common yoga protocol just to bring awareness to the general masses and community. This kind of teaching and learning is also a very important aspect of yoga when you want to use yoga as a therapy. So my experience with the yoga as a therapy has been there with the interest that we need to find out problem areas in different fields and sectors and try to tailor the yoga based on those needs of those sectors. So, for example, yoga in oncology is where I have been working on, and we have used yoga for various aspects like chemotherapy-induced nausea, vomiting, for fatigue, myofascial pain syndromes, and etc. and so forth. So we need to look at the problem areas in each field and start tailoring yoga for those interventions. And that is when you can truly integrate yoga with conventional medicine. Okay, and that can be based on certain evidence as well. And I thank Inygma Kerala for having me here to give a short note on this topic. And I won't take much time. We are there today in PJ Chandigarh. We just had a Asia Book of Record today, where we had the largest number of doctors doing yoga at one place. 1,924 doctors doing yoga today at PJ Chandigarh. So I'm still here today. We had this was followed by several lectures, workshops, competitions, and all. So so yoga is now catching up in the medical community as well. And this is where I feel BMS doctors should take the advantage, should work closely with the modern medicine specialties and with researchers, do a lot of research on different aspects, develop good modules, therapeutic modules to integrate yoga with the conventional medical care. And that's how yoga can be taken forward. I thank Inygma Kerala for being very active on this occasion of the International Yoga Day. And I thank Dinesh Karta and his whole team from Kerala chapter for organizing this seminar on this auspicious day. Thank you, one and all. Namaskar.
Yeah, thank you. Thank you. Namaste, Dr. Raghavendra. And now we are going to start the webinar. So I invite Professor Dr. Manjunath S. MD, Professor Physiology, Dr. B.C. Roy, Multi-Speciality Medical Research Center, Indian Institute of Technology, IIT Kharagpur. The topic, Science of Yoga, Research-Based Evidence on Yogic Practices and Effects. Please take on the test, sir. Please.
Namaskar. I hope all of you are able to see me. Can you hear me?
Yeah. Yes. Please, please.
Sure. So what I will do is that I will switch off my video, try to reduce the bandwidth, and I will share my screen so that we'll all be able to look at the screen. So that I'm disconnecting my video. Let me share my desktop. And then are you all able to see the slide? Can
Yes,
anybody? Okay, thanks, Arun. Thank you. Fine. Okay. For most of you are already aware of yoga because you are graduates of yoga and naturopathy. For what I will try to basically address very briefly, because it's only 20 minutes. I may not be able to cover everything in depth, that too with evidence, but I'll try to summarize what is the best evidence that is available. And the topic I would be discussing as far as possible is science of yoga, physiological effects of yoga practices, and their clinical applications. I have no conflicts of interest. The only conflict of interest or no conflict of interest that I would like to discuss is that I am not going to be any emotionally involved in this presentation. We will try to keep it as objective as possible, and then only we'll be able to critically analyze the data that is available in terms of effectiveness. Therefore, we all know what health is. A WHO definition of health is a very big definition. And therefore, let me not go into the details. But we also know what disease is. Lack of health is a disease. And we know there are three major varieties of diseases: the genetic diseases, environmental diseases, and multifactorial. Of late, everything has been multifactorial because there is always an interaction between the environment and the gene. But out of all this, the most important or resurgence, or actually epidemic of the disorders that we have are lifestyle disorders like coronary artery disease, hypertension, and type 2 diabetes mellitus. Now, once we start talking about lifestyle disorders, then automatically we have to look into yoga. That's because it is said that yoga is the best lifestyle ever designed. And therefore, once we have a lifestyle that is best possible, why don't we use the principles of this, especially in the treatment of lifestyle disorders? That's what the way we have to take it forward, and we'll try to understand that part. Now, I'm not going to discuss different types of yoga. All of you are aware of it, but each individual has a different understanding of yoga, and there is a lot of confusion, not only in the Indian literature, but also in the Western literature. In spite of that, there has been a lot of interest in yoga, especially starting from this millennium. For in 2001, Time magazine published a dedicated issue on the science of yoga, as you can see here, which was followed by a couple of years later about the mindfulness and how mind can heal our body. It's a special issue. And that was continued with a special issue on the science of meditation. Therefore, within a couple of years, there were a lot of topics that were covered in Time magazine. And even in 2004, there was another Times whole issue about the mindfulness revolution, especially in relation to the yogic practices that were especially becoming popular in the West, especially in the United States. And this was even before the institution of International Day of Yoga in 2014 in June. That is also correlated with interest in research community. And as you can see, the publications in yoga, especially this is from Medline only. Initially, there were hardly any publications till the beginning of this millennium. Therefore, in even up to 1990 and 2000, there were about 15 to 20 articles, and the cumulative was only about 200 to 300 articles. Therefore, when I started my research in yoga, there were hardly any articles, and actually I could keep pace with the development that is happening. But as you can see later on, there is an exponential growth in the number of articles, and especially in the last 5 years, post-COVID, the number of articles is so high that we are getting about 800 to 1,000 articles every day. It should make us happy because there is so much of research evidence that's being available. Unfortunately, that is not the case. Though we have research articles, but all of them are not of good quality. And recently we have tried to do a meta-analysis or systematic review of articles in relation to yoga and upper respiratory infections. And we were disappointed to see that such poor quality of articles are available. The evidence is extremely poor. And ultimately, we couldn't even do a meta-analysis because the data that was available wasn't even sufficient for us to do the meta-analysis. Therefore, just because there are articles doesn't mean that the evidence is good. Therefore, when we look at this, there are a few things that we have to keep in mind, especially in relation to research in yoga. There are a lot of limitations in the studies that are being published. The limitations mainly that we have to look into are that most of these populations that are studied are self-selected populations, because whenever we study, those who are interested in yoga, they participate, which obviously means that there is some selection bias in these populations. Then many of these articles have no control group or very, very inappropriate control groups. For the yoga intervention group, there are hardly any control groups that are possible. And the outcome measures are also not very standardized. And most of these studies use the self-report outcome measures, which are pretty subjective, and therefore it's very difficult to make sense out of that. And at the same time, the most important difficulty most of us from allopathic medicine feel is that the yoga protocol intervention that is described is highly, highly variable, or it's poorly described. And this becomes very difficult for us to extract the data because there is no comparison. So one study has some asanas done for a few days of a week, and then that is done for a period of about 6 weeks or 8 weeks. And then there is no supervised interventions. And all these things really limit the usefulness of the data that is published. Therefore, whenever we study later on, we have to keep these limitations in mind and look at the data objectively rather than being emotionally involved in saying that, oh, there is a lot of research that is available in yoga. Now, why are these limitations? That's because there are a lot of difficulties in doing research in yoga. The one important difficulty is that the population which can do sincerely and sustained practice of whatever intervention we want to do is very difficult. Therefore, sincere and sustained pursuit of yoga is not easy. The time, cost, and lack of pragmatic information are other issues that are associated with any yogic intervention. People always say that, oh, I don't have so much time to do yoga, or I don't find a good yoga instructor and they're pretty expensive. And at the same time, even the interventions that are described are not very pragmatic. And later on, if the study population, they want to ask questions, people are not available to give them pragmatic answers. But if there are sustained, accomplished yogis that are available, it's difficult to find them. And even if they are available, they don't usually participate in the study because they are averse to publicity. That's why it's really difficult to find such people. And last but not the least is, whatever changes that we observe in them, many of them are attitudinal or subjective. Like say, many of the student participants say that I feel good, or my pain has decreased, or I feel better. So these are some of the things which are very difficult to objectively quantify. Therefore, there are difficulties in conducting the studies with respect to yoga, and at the same time, there are limitations. But when we combine these two together, now we can easily understand that it's not very easy to find a good quality study from which we can extract scientific information. But in spite of that, there are few studies, and based on the summary of that, I'll try to discuss the physiological effects of yoga. Two important systems that are associated with yoga, or three we can say, is that respiratory system, cardiovascular system. Actually, they work together, therefore we can say it as cardiorespiratory system, and the musculoskeletal and nervous system. For I'll try to discuss like this. Let me first start with respiratory system. So whenever we want to study the changes in the respiratory system, we do an investigation called as simple spirometry, with which we can identify certain parameters of the lung function. And what we could find in sustained practice of yoga or yoga intervention is that there is a decrease in the respiratory rate and minute ventilation. Before the people start breathing at a slower rate, and they take relatively less volume, which will still be sufficient to oxygenate their tissues. And using computerized spirometry, we can have few more parameters analyzed, like forced expiratory volume, vital capacity, maximum voluntary ventilation. Many of these parameters have been found to improve with yoga asanas, especially those yoga asanas which have a strong breathing component, like pranayama studies. There is an improvement in the breath holding time. They can hold the breath for a longer time, and they are able to generate a lot of respiratory pressures because their respiratory muscles are strengthened because of these yogic practices. And at the same time, there is a decrease in their chemoreceptor sensitivity, which means that they are now less sensitive to carbon dioxide accumulation, and therefore they can hold the breath for a longer time. Therefore, these are the major changes that we can see with yogic interventions in respiratory system. And this is always correlated or accompanied by certain change in the cardiovascular system. So what are the major changes that we can observe in cardiovascular system are that with sustained practice, there is a decrease in the basal heart rate and blood pressure. This is one of the studies that has studied 10 people. And what we can see here is that there is an immediate acute effect of yogasanas on the heart rate. For pre versus post, if you see in 10 different individuals, in most of them, there is a significant decrease in the heart rate after the yoga intervention. Therefore, this is an acute effect. And this is also seen as a chronic effect, as you can see, after over a period of 26 sessions or a period of few weeks, their pre-session heart rate and post-session heart rate, as you can see. Therefore, there is not only an acute effect, but there is a gradual decrease over a period of time. Therefore, there is a chronic effect of this yogasanas on the heart rate. And this is also reflected in changes in the blood pressure. Therefore, this is the systolic blood pressure and this is the diastolic blood pressure. As we can see, there is a sustained and gradual decrease in the systolic pressure as well as in the diastolic pressure over a period of time of 26 sessions spread over few weeks. Therefore, yes, yogasanas or yogic intervention brings about not only change in the heart rate, but also in both systolic as well as diastolic pressures, which is very, very beneficial. Along with that, it has also seen that it increases our parasympathetic activity and increases the vagal tone, and therefore that increases the heart rate variability, which actually is good for us. And it restores the baroreceptor sensitivity. And hypertension is supposed to be a problem, is a consequence of problem in decreased sensitivity of the baroreceptors to blood pressure. And by doing yogasanas, it has been shown that the baroreceptor sensitivity can be reset to normal, which in turn is responsible for decrease in the blood pressure. And not only in the parameters of heart rate and blood pressure, even it increases or improves our cardiorespiratory fitness, which is very important for athletes and all. Therefore, here peak and recovery heart rate improve following strenuous exercises like Harvard step test. This can be checked with these tests, and what we can see is that sustained practice of yoga does improve our cardiorespiratory fitness. So these are the major effects on cardiorespiratory system. The other important system that is involved in yogasanas is musculoskeletal system. What we have been able to identify is that with yogic practices, there is resting muscle tone and spasm decreases over a period of time. But at the same time, there is increase in certain specific groups of muscles depending on our type of yoga intervention. We can check that using instruments called as hand grip dynamometer, which clearly shows that there is increase in the hand grip strength. Especially, there is an improvement in the range of movements, the flexibility and balance. And this has been extremely useful in elderly population who have major problems with their balance, their flexibility and range of movements, especially across multiple joints. And yogasanas have been especially found to be useful in geriatric population. This data shows clearly here how the upper extremity and lower extremity strength has improved with 8 weeks of yogasanas. And at the same time, there are a couple of tests which tell about the fitness overall, which is called a 6-minute walk test or 2-minute step test. And both of them have been found to improve with yogasanas. Therefore, it is a comprehensive improvement of cardiorespiratory fitness with musculoskeletal and joint systems. These are the major effects that we can easily understand because these are the systems that are directly involved in yogasanas. But what about other effects like general and metabolic effects, which basically are reflective of endocrine changes? There is some weight loss, yes, but especially there is decreased weight gain. Therefore, there are less number of obese people among yoga practitioners. That's mainly because of better lifestyle, as can be seen in this diagram, wherein this diagram, the black arrows show the yoga practitioners and the hatched ones, non-yoga practitioners, are average US citizens. As you can see here, those people who are practicing yoga, they have better lifestyles, especially in terms of there are less number of smokers among the yoga practitioners, there are more vegetarians among yoga practitioners, and there are less number of obese people among yoga practitioners, which reflects better lifestyle that they have followed. And because of that, there is better lipid profile and an improvement in the antioxidant defense mechanisms like certain antioxidant enzymes like glutathione peroxidase and superoxide dismutase. So these are metabolic effects. Another system importantly involved is nervous system, wherein we can find that there is decrease in the sympathetic activity and increase in the parasympathetic activity. Decreased sympathetic activity is reflected as decreased anxiety, stress, and other things. Parasympathetic is basically a restful, relaxed condition, and therefore, naturally, they are more relaxed. When we record the electroencephalographic rhythm from the brains, it can be seen that there is an increase in the alpha rhythm in the EEG and coherence of the left and right cerebral hemispheres, which basically means that there is better relaxed state and also more synchronicity across their cerebral hemispheres, which leads to better cognitive performance, both verbal as well as spatial skills. For when you are relaxed and when both the cerebral hemispheres work together, therefore there is always an improvement in the cognitive performance. It seems that many of them have better pain tolerance and there is decreased fatigability and better sleep, which anyway Dr. Kamlesh Gulia is going to discuss more about. Now, these functional changes are correlated with anatomical changes in terms of larger volumes in specific brain areas, and also the proportion of white matter to gray matter has also changed. More gray matter could be seen, which reflects that there is better neuronal density. Doesn't mean that there are neurons, it could be even the dendritic density, which basically shows that there is better retainment of gray matter. And the neuronal development is mainly to certain growth factors, and it has been shown that there is improvement in the brain-derived neurotropic factors. And other important psychological benefits that Dr. Narasimha might also be discussing is that there is decreased anxiety levels, decreased stress perception, and at the same time, there is better sense of well-being. These are the nervous and psychological effects. The endocrine manifestations of yogasana practices are that there is decrease in the baseline and average glucocorticoid levels, which is indicative of chronic stress levels. Higher the chronic stress levels, higher will be the glucocorticoids, but there is a decrease in the average glucocorticoid levels in yoga practitioners. At the same time, their ability to face challenges by excreting or secreting more glucocorticoids is improved, which means that they can tolerate acute stress better. Therefore, there is increased glucocorticoid response to an acute challenge. There is increase in the melatonin levels. Of late, melatonin functions have been shown to be very, very important in diverse functions, not only just for sleep, but also as an antioxidant defense mechanism. And it also is supposed to be a regulator of biological clock. There are major metabolic improvements in terms of decrease in the fasting blood glucose levels, and at the same time, there is an better insulin response to a glucose challenge. Both are beneficial to the body, and thyroid hormone levels also have found to be changed very favorably, and prolactin levels. And not only at the organ level, some evidence also shows that some of these changes can be observed at the genetic expression level, though I'm not going into the details of it. Which means that yogasanas or yogic practices affect not only at the whole body level, it also affects the organ, cell, and subcellular levels. Only thing is that we need to be able to do much more studies to identify effects, not only identifying, but also better quantifying them. So if these are the health benefits of yoga, how can we use it for clinical practice? Are there any evidences? So I'm going to just summarize because we don't have too much time anyway. For yogasanas or yoga intervention has been used in treatment of diabetes mellitus and metabolic syndrome. There are enough articles which show favorable response with yogic intervention. In coronary artery disease, one of the earliest studies by Dr. Dean Ornish from Harvard Medical School have clearly demonstrated that yes, there is reversal of coronary occlusions, which can be documented by angiograms. Therefore, it has been clearly shown that there is reversal of coronary artery disease with better yogic intervention. Hypertension has been reduced. Pulmonary disease, especially asthma, has been found to be very responsive to yoga interventions or yogic interventions. There is some evidence for chronic obstructive pulmonary disease also. Musculoskeletal abnormalities like backache, headache, neck pain have been treated well with yoga postural adjustments, yogasanas. And then even there is evidence to show that osteoarthritic and rheumatoid arthritis changes, especially the pain associated with these, can be relieved with certain postures or certain asanas. Even stroke as a palliative care, yogasanas or yogic treatment has been used in stroke patients. And psychological abnormalities or disorders like anxiety, depression, post-traumatic stress disorder, insomnia, and IBS have all been treated with yogasanas. And as already mentioned briefly, cancers, especially in intractable cancers or terminal cancer issues, yogasanas have been, or yogic lifestyle has been found to be very, very useful, if not for prolonging life, but especially in improving the quality of life. And that has been a major effect in terms of the quality improvement in quality of life in many cancers. For true examples are breast cancers and lymphoma. Therefore, if you are interested, there is one review article, especially in this by Tiffany Field. This is a comprehensive review. I suggest that many of you who are interested and go through this. And this is another good book on yoga. For most of the times, what we discuss is only beneficial effects of yoga, but there are risks associated with yogasanas also. It should not be done indiscriminately. And this discusses some of the risks that are associated with yoga practices also. I recommend that this is another very good book. So to conclude, available data indicate that yoga has beneficial effects on human body functions. Yogic practices may help and promote improvements in the management of many diseases like type 2 diabetes, mellitus, coronary artery disease, etc. But we have to take this evidence with a pinch of salt because we need additional high quality studies both to confirm and further elucidate the potential therapeutic benefits and long-term effects especially. And the potential underlying mechanisms need to be further explored because most of these studies are mostly descriptive studies and none of them or most of them do not really address the mechanism behind the effectiveness of yoga. That is the need of the hour to generate a lot of evidence. Thank you so much. And if you have any questions, I'll be happy to answer. Dr. Narsim, Arun, yeah.
Yes, sir. Thank you very much for that enlightening sessions. If any of us have any questions, please write down in the chat box, and we can answer them, all of them, at the end of the session. Is that fine, sir?
Yeah, that's fine with me. Sure.
Sure. Thank you, sir.
Which means that Dr. Arun, you are going to summarize those questions at the end, is it?
Yes, sir. Sure.
Yeah, sure.
Dinesh, sir, are you there?
Yeah, yes. I am here. Yeah. Yes, shall we go for the next speaker? Yeah.
Yes, sir. Yes.
Yeah. So I'll be leaving around 8 o'clock.
Okay, sir. Yeah. Next we have the next speaker is Dr. Kamalesh Gulia, ma'am. Ma'am is scientist from Sri Chitrathirunal Institute of Medical Science and Technology. And ma'am will be talking about the sleep related and insomnia related connected to our yoga system. And I already shared ma'am recent project and its SRF and JRF opportunity that's coming up in Sri Chitra soon, and we are waiting to hear from you, ma'am.
Thank you, Dr. Tejas. Can you hear me?
Yes, ma'am, we can hear you.
Okay, wonderful. So, namaskar to all of you present here. At the outset, let me thank Dr. Dinesh Karta for such a vibrant, introduction to the whole program. And I'm so glad to see my old friend of the AIMS time, who has given you, in a way, he's laid the foundation for today's program. Dr. Manju, nice to see you after a long time. And welcome to all the participants. And I'm so glad that Dr. Raghvendra was also there for some time. As the topic, Yog Nidra, a potential therapeutic tool for the management of insomnia and elderly life. So why, I would have taken this topic for the simple reason that sleep is a dynamic process. That means when we are born, the child spends 60 to 80% of the time in sleep. The brain is making the networks, it is developing, and also it is polyphasic in nature. That means the neonate sleep a couple of hours and wake up and then sleep. So for 24 hours, there is no idea of, circadian rhythms, and they developed gradually as the baby grows. So by the time they are, in the childhood stage, 4 to 5 years, they become, kind of night sleep is longer, but the daytime still they need one nap, a longer nap, and that's their physiological need. So we need to understand the physiology. So as in on there is a growth, the brain develops. The sleep becomes monophasic in the adolescence, but still the need is little longer. Because there are several hormones which are having the sleep induction effects. And then by the time we reach into the adulthood, so it is monophasic. Of course, in different situations, like if it is summer, we can have a nap, and we are too tired, we can have a nap, but broadly it becomes monophasic. And as we grow older, because of the deterioration of the brain networks and the body as it is, the sleep quality becomes very poor. Not only the quality, the quantity also reduces, both the components of the sleep, that is the REM sleep and the non-REM sleep. So that is the challenge, considering the fact in today's time, with the good medical care, the longevity has increased. And on an average, as Sir also mentioned, that in Kerala, we have the highest, the aging, the Kerala population, I think it is about now 16 to 17%, which is the national average highest in this state. Now, if we see from, every couple of years, the elderly population is doubling. So by 2050, if we are expecting 2.1 billion globally, so this is a concern because not only hypertension, diabetes, dementia, depression, several brain-related disorders, anxiety, cancer, joint disorder, which are too common in this age. The sleep is something, if you do not get one night's sleep, your entire day becomes very, very fatigued, very, very painful. So sleep is something which is, associated with so many of these conditions. So the Sustainable Developmental Goal, it says the good health and the well-being. It is a big question mark how to get that. So I hope by the end of this talk, I may be able to answer this question. So let us see if I give the problem statement, the menopause state, when especially in the women, it is very dramatic. So after 40, 45, the drop in the hormones, estrogen and progesterone. So that is marked by several health difficulties because, the hot flashes are observed, night sweat is there. So sleep and thermoregulation are so closely related that when the body temperature goes up due to hot flashes, sudden hot flashes, the sleep problems appears, and it leads to several mood changes, and there are metabolic changes also happening because of the slowed metabolism. There is a weight gain experienced by people, and there is a reduction in overall quality of the life. Now, the thing is that we cannot have the medicines for a longer time because it's almost 25 to 30 years of the life we are spending in this age group. From 50 onwards, the average, the life is about 70, 75 years. Especially in the women, they sleep for 3 to 4 years or 2 to 3 years more than the men. So how to deal with this? We have to have some non-pharmacological intervention. So for that, I'm sharing a small pilot study with you. As they just mentioned that we are running RCT. For that, the project staff call is already there. So this RCT we did during the COVID time to see the effect of Yoga Nidra on the management of insomnia and the overall well-being in the postmenopausal women. So we took the objective measures in the sense we used the actigraphy. First, we took the baseline of 4 weeks and followed by 24 weeks of Yoga Nidra in the morning. And we introduced also the walking protocol in the evening, about 30 minutes. So the subject was about 56 years old women, postmenopausal, with no history of hypertension, diabetes, or any neuropsychiatric disease. So as I mentioned, the objective assessment for the actigraphy. And we also have, there is a software takes care of, the BMI. And a subjective assessment of mood were done by some questionnaires. And we asked the people also to maintain a sleep diary. And we've taken certain parameters in terms of sleep latency, the total sleep time, the number of awakenings, because this population generally have early morning awakenings, waking up at 3 o'clock, 4 o'clock. And then the people don't know what to do because the whole family is sleeping. Youngsters are sleeping. They feel that there's something wrong in their body. And the mood during waking and mood during the daytime, these are some of the things we noted. So then let's see whether Yoga Nidra improved the well-being or not. Let's see. So this is a picture showing it is this practice is done in the this position which is called Shavasana. And this is the picture of the actigraphy, which person wear continuously on their non-dominant hand. And only when the washing activities are done, it is to be removed. So we use the Yoga Nidra method of Swami Saraswati from Bihar School of Yoga, that cassette, so that it is uniformly administered in all the people, and some exercise. So if you see this, the right side, there are some panels. These are nothing but output of the actigraphy. So each line is output of an actigraphy. So the first one is a pre-intervention, the control, also called the baseline. In this, you see, the area between these dotted lines. So this is, 4 weeks, means almost a month. So you see this area where there is a less activity. This means that this is the time spent in the sleep. However, you also see the small areas shown in the red lines, these are early morning awakenings. You can see the person wake up and almost for 3-4 hours, they're not able to go back to sleep. You see, it's very often happening here also. So, and on before the intervention, this was almost like about 6 hours of the sleep. And then after 24 weeks of, Yoga Nidra intervention, we analyzed the comparison between, the 4 weeks and every 4 weeks. So what we found that, the sleep latency, that means when you get into the bed, the time to get into sleep, that reduced by almost a month, by 4 weeks. However, the total sleep time, it took almost 16 weeks to improve. So from the 6 hour to almost 7 hours, it took almost 16 weeks of practice. And then later on, it was stable. You can see in the next, that is 24 weeks of post-intervention. So the sleep quality was also improved. And when we questionnaire based, that is the subjective measures, when we asked the people, they said when they wake up, they felt refreshed and they felt happy. And however, in this 6 months of practice, we didn't find a significant change in the awakening. They were still there, but what good thing was that they didn't feel bad about it. They were okay because they didn't find any headache, they didn't find any body pain, and so on. This the small study we also published in Sleep and Vigilance. So in a way, if we look at this practice, there was an improvement in sleep latency. And also, after almost like 16 weeks, the duration also increased. So we can think of this as a non-pharmacological therapeutic technique for the management of sleep health in the women. Not only the women, it can be used for the men also, but in women, as I mentioned, that the drop in the hormones is so sudden. However, in the men, it happens very gradually. So the effect may not be that eminent, that hot flushes may not be found in them. And also, as I mentioned, that the life expectancy in women is few years longer than the men. To sustain the healthy postmenopausal life of about 20 to 30 years, which itself is a 1/3 of your total lifespan. So this technique may be applied to improve the quality of life and the productivity, both in offices and at home. So this is a base, it was an experiment to do the evidence-based approach or to bring more scientific evidences to our ancient yoga technique. As I told that in the beginning, that third goal, sustainable development goal, is the good health and the well-being. So now you can very well imagine that with these yogic practices, we can actually bring the evidence. When we give the evidences, the people have made trust in it, and then more and more people, even in the hospital setup, maybe giving this as a therapeutic strategy to deal with the insomnia in this population. So also during COVID time, because the children are the one who could be brought more awareness about the sleep. So like this yoga day, I just would like to tell that for the children, I have written during the COVID time a book, Sleep Wisdom for Children as a Nature Symphony, to give them awareness what is sleep, how the animals sleep around us, what happens if sleep is interrupted, what happens to the sleep of our sleep if we are sleeping in the bright light, and so on. So these are some of the concepts which pictorially and in the cartoon form they are explained to the small children. So I end up here because I was told about 20 minutes to be expressed in this auspicious yoga day. So in fact, Yoga Nidra, if I can say, Yoga Nidra, it is not something that by doing this yoga, you get into sleep, but it is something that you have to be conscious, but go into a state of a deep relaxation. So in a way, it is misnomer. It is not that when you are doing the yoga, you get into sleep. If you get into sleep, you are not doing Yoga Nidra. You're doing something else. You are actually sleeping. So that is the beauty of the Yoga Nidra, that you are utilizing, the elderly population can utilize their time of their early awakening, can use this strategy to rejuvenate their body and to utilize their time and to have multifactorial health benefit by doing this simple exercise. I think I stop it, and thank you for your kind attention.
Thank you, ma'am, for your lovely presentation. I hope people will have definitely some question related to sleep and yoga practices. Uh, 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 that people can write all of you can write your questions in the chat box, and we will take it up at the end of the session.
Yeah,
Thank you.
and also, Dr. Tejas, those people who want, the call is there for, detailed EEG work that is being conducted under this randomized control trial. So
Okay.
that call is on the Sri Chitra website. It is already there for JRF and SRF both.
Yeah, sure, ma'am. Sure, definitely.
Thank you very much. Thank you.
Thank you, ma'am.
Thank you to Inygma. I hope I pronounced it correct. Inygma. Thank you.
Actually, it is Inygma.
Inygma. I'm sorry. That's why I said I am not pronouncing it correct. Thank you so much.
We all are Inygma members, Indian Naturopathy Yoga Medical Graduates Association. We have that centrally, and we have our Kerala chapter separately, and we are the one which is organized.
I think
Thank you,
it's a
ma'am.
wonderful move. Thank you so much. Thank you.
Next, we have our speaker, Venkatalakshmi Narasimha sir. Dr. Venkatalakshmi Narasimha sir has done his MD postdoctoral fellowship and DM from NIMHANS, and also he has addiction medicine certification from International Society of Addiction Medicine, and currently he is working as an assistant professor in Center for Addiction Medicine, Department of Psychiatry in NIMHANS. I welcome you to give your session, sir. It's yours. Thank you.
Is my voice audible?
Yes, sir. It's audible and the screen is visible. Thank you.
My slides are moving?
Yes, sir.
Okay. So first of all, thanks, Dr. Arun and team from Inygma that has invited me for talking on this topic. I would also like to thank Dr. Manjunath. Sir has been inspirational in terms of me working in the area of yoga for last 1 or 2 years. Okay, so without much waste of time, so what do I do? Because I work at Center for Addiction Medicine. So what kind of patients do I see? For example, this was the OPD on Monday. So I have seen people with alcohol dependence who come with depression, who are elderly. And I also see people with heroin dependence, people who inject heroin with having a HCV. And also adolescents using cannabis and meth. I think Sir was telling in the beginning, Kerala has a lot of problems with drug use. And one of the major problems that Kerala is facing compared to other parts of the country is increase in meth use and meth psychosis. This is something that we are seeing even in Karnataka. And again, adolescent boy, college student who has been brought with autism kind of a picture, along with internet gaming disorder. So this is something that I commonly see in my OPD and at the Center for Addiction Medicine, NIMHANS. Okay, so a brief disclaimer that I am not an expert in yoga. However, I'm a clinician, and I am also a researcher with who tries to incorporate yoga in the clinical practice. Also, I have been working with a couple of yoga projects which are looking at as a potential treatment option for addictive disorders. So the contents that I'm going to present are my personal views and do not reflect the views of the institute that I represent. So what are the objectives of my presentation? I have 2 objectives. First of all, I would like to tell all of you what is addiction. Second is I would like to highlight some of the yoga related research in addictive disorders, both from our center, also internationally. So let me tell you what addiction means. So many of us have this notion that people who are addicted are bad people, and there is a lot of stigma associated with addiction. But over a long time, at least for last 50, 60 years, there has been a lot of research that what has been found is that addiction is something that is treatable, and it's a chronic medical disease like diabetes, hypertension, addiction. People who suffer with addiction, it is recognized that it is a chronic medical disease. And why do people become addicted to these substances? So once this substance goes into the brain, it causes a lot of changes in the brain circuits. And it is also something that is related to genetics. Not everyone who use substance become addicted to the substance. Genetics play a role. That is, if there is a family history of addiction, then there is a higher risk of addiction. Also, environment plays a role. For example, people, if there is no availability of a particular substance, the chance of person becoming addicted to that substance may not be high. Or if the person did not start substance when he was an adolescent, then the chances of he starting at an elderly age might be less common. So environment also plays an important role, but it's a complex interaction between brain circuits, substance per se, genetics, and environment. Also individual life experiences. For example, children who has underwent a significant amount of physical or psychological trauma as a child, so they are at higher risk of using these substances. And what happens once the person become addicted to these substances? They start using it in compulsive manner. Although they wanted to stop these substances, but they find it difficult to stop, despite having some harmful consequences. You might be seeing a lot of people, even they have liver disease, heart disease, but still they continue to use substances because the compulsive nature, as the brain changes, the addiction component becomes more compulsive. That becomes difficult for them to stop the substance. And over a period of time, what we realized is that prevention and treatment is something that is generally helpful. Similar to the chronic diseases, like for example, diabetes and hypertension, how they can be prevented to some extent and treated to a maximum extent. In the same way, addiction also can be prevented and also treated similar to these chronic diseases. Okay, so as I told that this is a brain disease, what happens is initially a person starts using substances on and off, on and off. Over a period of time, what happens is there is a significant amount of change that happens in your brain. When the person doesn't use these substances, the person starts having this withdrawal effect. Although he started impulsively for a kick, over a period of time, when the substance is not there in the blood, then the person starts experiencing withdrawal symptoms. These can be physical withdrawal symptoms. These can also be psychological withdrawal symptoms. And over a period of time, the substance brings in a lot of changes in the brain, which makes them preoccupied by these substances. And there is something called as craving. Then there is something called as loss of control that happens. And then the person continues to use this substance again and again. Again, this is something that has been well studied in last 15, 20 years. A lot of MRI, both structural and functional MRI related research has shown that these are some changes. When do you call a person addicted to these substances? When there are 3 out of 6 criteria, that is when there is craving, tolerance, loss of control, that is the person wanted to take a little bit of substance but ends up taking high amount of these substances. When there is use despite harm, which means that the person is experiencing a lot of damage but still continues to use. Withdrawal symptoms and salience. If 3 out of 6 are there in last 12 months, then you call this person or a person dependent on these substances. So there are, again, at least at this point of time, there are substance use disorders and there are also behavioral addictions. Gambling, this is very commonly seen in Indian context. And there is something called as internet gaming disorder. This is something that is becoming more common in last 2-3 decades. So why do people become addicted to these substances? Is it something to do with drugs? Is it something to do with the person? Is it something to do with the family? Or is it something to do with society? Or is it something to do with the government policies? So the answer is a combination of these things. So a person becoming dependent on a substance is not just it's not just he's a bad person, that's why he became dependent on. No, it's not like that. It is a combination of multiple things. So that's what we call it as a biopsychosocial model of addiction. Like already I have explained that there are multiple factors that leads these people to go into substance, not only the genetic factors, but also family history, people using substances at a very young age. So the person using substances, when a person tries substances at an adolescent age, the chance of he becoming addicted increases. Then there are environmental factors. People with comorbid psychiatric illness like depression, bipolar, they are also at higher risk. And early stress is also one more vulnerable factor. And what we do in clinics is identifying these cause and help them to come out of these substances. So, for example, you might be seeing people who are in occasional users. You might also be seeing people who have severe form of dependence. For example, if I have to give an example of alcohol dependence, so when a person comes to us with a severe alcohol dependence, how do we manage? So we give them treatment for their medical comorbidities. We also treat their withdrawal symptoms with benzodiazepines. Once we stabilize them, then the main component of treatment starts, which is preventing relapses. So there are some medicines that helps to prevent relapses. And people do come with different stages of motivation. Some people wanted to stop, some people don't want to stop, some people decided that they wanted to stop, some people already have stopped, but still they wanted to have some help for their addiction related problems. So right now, how does yoga fit into this treatment picture? So there is, apart from medicines, there are also therapies which has been well studied. Some of them are motivational interviewing, cognitive behavior therapy, group therapy. Manjunath sir spoke about mindfulness, which is something that components of mindfulness have been taken from the yoga practices that has been prevalent. So mindfulness components are being very well studied in various psychiatric conditions. So yoga becomes a part of our treatment. So at Nimans, yoga is one of the components of the treatment. All the patients who are admitted with us, yoga also is a part of their recovery process. So again, without acknowledging our gurus, Professor B.N. Gangadhar sir and Shivaram sir and the team from Department of Integrated Medicine at Yoga, they have been doing a commendable job, and they have been inspiring us to work in this area. And this is the Department of Integrated Medicine at NIMANS. Okay, so this is one chapter that we have written. I have written Yoga for Substance Use Disorders. And this is the book that has been brought from Professor B.N. Gangadhar and sir's team on the science and art of yoga in mental and neurological healthcare. If anyone is interested, please go through this book. So why yoga for substance use disorders? So when we reviewed the existing evidence for yoga for substance use disorders, what we identified is that this is one of the viable options as a part of adjunct therapy. So as a part of the holistic management, yoga becomes a part of the treatment. Why? Because yoga may reduce the severity of substance use disorder and improve the quality of life in patients suffering with substance use disorders. So there is evidence for various conditions. For example, yoga has been studied in people who are injecting heroin. So yoga has been studied as an adjunct, that is, people receiving treatment. Along with the treatment, yoga has been added as an add-on, and they found that yoga improves the outcomes in various domains, in terms of the quality of life, in terms of the perceived stress, and in terms of the retention to treatment and treatment outcomes. So there is also some evidence of yoga as an add-on for alcohol use disorder. Some of this evidence comes from NIMANS itself. There is a study on Sudarshan Kriya Yoga as an add-on for people with alcohol dependence. The main component that yoga helps is, as Manjunath sir was pointing out, in terms of the depression scores and also in terms of the anxiety scores. The second, why this depression and anxiety is very important is because during withdrawal, people have these depressive symptoms and anxiety symptoms. And they also try to look into the cortisol levels and ACTH levels. These are some of the hormones that researchers have looked into, especially in this study. Again, yoga has also been studied in for helping people with tobacco use disorders. This is one interesting study. A pilot study was done in 2011, and another study was done in 2018, looking into people's functional imaging, where they looked into the activations in different parts of the brain. Particularly in brain, we have, like how in car there are brakes, there is a motor, there is brake, there is clutch. So the motor is the emotional part, which is the amygdala and the limbic cortex. So what they have found is that when there is Om chanting, when Om chanting happens, there is a decrease in the motor, the amygdala activation or the limbic system activation. This is some interesting article. I would recommend people to go back and see this article in terms of the activations in the limbic cortex that gets reduced with Om chanting. So what could be the probable mechanisms how yoga might help? Again, this is an image from our book chapter. How can yoga help is that, as I was telling, it not only reduces the activity of the uh, motor of the car, that is the emotional part of the brain, but also it helps in terms of the so the gear. It helps better control over the gear. It also brings in better control over the brakes, that is the prefrontal cortex. So this is how yoga might be of some help in people with substance use disorders. Again, we have recommended for people who are providing care for people with substance use disorder, there are some tips in terms of what kind of practices needs to be followed and what kind of practices to be avoided. For example, people with substance use disorders all do come with withdrawal symptoms. So during that time, they have a lot of physical symptoms. At that point of time, doing activities which activate more of your sympathetic nervous system, so those things need to be avoided. For example, Kapalbhati, Bastrika. So these are some things that needs to be avoided during the acute withdrawal period, whereas pranayama can be practiced during the acute withdrawal period. So there is a research that is ongoing from one of our colleagues on using Om chanting during the acute withdrawal period, which is right now the research that is ongoing. Again, during the sessions, people also do have a lot of irritability. So once the withdrawal phase is over, still the people have some certain difficulties. In those difficulties, what kind of practices might be of help? For example, pranayama, Surya Namaskara. So these are certain things that reduces the anxiety, also improves the muscle strength. So that is something that has been recommended. And again, after the sessions, what kind of after the session, what kind of practices needs to be followed? These are some tips that has been given in this thing. So as Manjunath sir was pointing out, that we need a lot of good evidence. For example, I practiced yoga and I have found it helpful. So that becomes a case report. Okay. 5 people from my family have practiced. So that becomes a case series. So these are very low in terms of the evidence. What kind of evidence? For example, Madam has presented a RCT, randomized control trial. So those kind of evidence stand high in the in terms of the evidence. So those kind of evidence needs to be generated. This is one of the protocols that has been approved by the Wellcome Trust funding agency from one of our researchers by name Dr. Hemant Bhargav. So who has been looking into the use of yoga as an add-on for opioid use disorders. So it has to be like a proper study design needs to be formulated, whether it's a single blind random. This is a single blind randomized control trial with proper power calculation and the study population. You need to define your study population. You need to have a comparative arm. You need to have a comparative arm to see how much yoga is better or compared to a comparative arm. So the comparative arm needs to be there. And at least when it comes to allocation, although we cannot blind 2 arms completely, at least the allocation needs to be concealed and the randomization needs to be followed properly, and at least the blinding can be at the level of the assessors, and we need to use a validated and standardized yoga program. For example, there are multiple yogas that are there. What components of yoga is going to help? So we have standardized one yoga program for opioid use disorders, and there are many standardized programs that are available for depression, anxiety. So those kind of programs needs to be the yoga program itself needs to be validated. And continuation. So this yoga arm also has tele yoga sessions which will be followed up for 22 weeks, and the waitlist arm will continue the standard treatment alone for 24 weeks, and doing assessments with involving more biomarkers. So we looked into biomarkers like BDNF, brain-derived neurotrophic factors, cortisol, ACTH. So incorporating biomarkers. Now we are also looking into epigenetic changes, that is changes that happens above the level of genes, which means that uh, histone deacetylation, methylation. So these kind of changes also we are looking into at a cellular level. So to summarize, as I told, I talked about addiction, which is a chronic medical condition and treatment is available. And I also tried to give in how yoga can fit in the treatment of addictive disorders. Yoga has a possible role in treatment of addictive disorder. But like how Manjunath sir has highlighted, Madam has highlighted, we need to generate a good quality evidence for yoga, not only in addictive disorders, but also across various spectrum of disorders. For that, it is very important to understand the research methodology in terms of how do you design research methods so that the evidence stands out, evidence speaks. So thank you for giving me opportunity. I think I will stop here. Thank you.
Yes. Thank you, Narasimha sir, for your wonderful presentation. And I think next we will move on discussing with Manjunath sir as well as Kamlesh Gulia ma'am on board with a few questions. I'll pin you with Manjunath sir just a second.
Sure.
Nice to have you, all of you, from different institutions, famous research institutions, and different field. It's really glad to hear from you three about yoga. We have this thinking that we know most of the yoga practice. For an example, Gulia ma'am has said only about yoga nidra, or Manjunath sir has explained a little bit about asanas and things. And also, Narasimha sir said which protocol to follow. If you ask me, yoga is, if I just sit and focus on my work, it is karma yoga. Most of them are karma yogis, including you three, completely on research. So, whenever we make a protocol, it is just, one or two, three asanas, one or two, pranayamas, and few things like that. And we are generalizing based on two or three protocols. We are generalizing that yoga, it is, we need evidence. Yeah, right. Do accept. So how do you see the entire yoga? Manjunath sir has research in the field of yoga as maybe on my age, like that many years you're into AIMS, earlier studies of yoga and all of that, right? Even Gulia ma'am know since then. But what's your thought on, it just, we are actually looking at two pranayamas and two yoga nidras and two meditation. That's a protocol. And we are trying to put this yoga into a template of protocols that especially modern medicines follow largely. Then do we miss out something about the yoga? That's a Manjunath sir.
Yeah, this is a very valid point which has been discussed. Can you hear me?
Yes, sir. Can
Okay,
hear.
very good. Therefore, say there actually scientific medicine, in general, any science for that matter, it always progresses in piecemeal. It is very difficult to have a holistic view. For integrating everything is not an easy thing. And that is how we have progressed. For right now, what we have been doing may not be perfect, but we have to start somewhere. And that's why, though, I mean, yoga has a very, very broad meaning. As we discussed, say, for example, one of the beautiful things I heard in recent yoga conference is that everything can be called yoga. Yes, yoga. Say, for example, Bhagavad Gita, all 17 chapters. The title itself says yoga, starting from the first Arjuna Vishada Yoga. Therefore, is Vishada Yoga? I don't know. For sometimes what happens is yoga has a very, very broad meaning. But at the same time, with our background, what we try to establish is what is the most beneficial or applicable parts of yoga that we can take, and then try to look at the scientific evidence that is possible in them, and then gradually try to integrate. So, for example, yogasanas, the most visible part, and people can follow. But at the same time, is if you consider the Raj Yoga, yamas and niyamas, we can't quantify that. Though one thing says that you should always tell the truth. How do we quantify? How do you assess that you have always been telling the truth? Therefore, that's part of yoga anyway, right? Some of these things are not easy to quantify. Therefore, though we are going as a piecemeal approach, the shorter approach, but we with the hope that if small itself, a part of yoga itself is going to show that benefit, then we have scientific reasons to believe that when we integrate more of this, the effects could be not only additive, it could be even cumulative, or it could be even synergistic. Well, that's what the hope that we will have. But we have to start, we have to have some evidence so that people are convinced about the effectiveness of this. And then with an objective base of evidence, we will be more confident in using this, especially for the benefit of patients. That's what I think I can say. And Dr. Narasimha also has a lot of experience. Dr. Narasimha, you would like to add something?
Yes, sir. Only one point I would like to add here. The scientific methods that are used are the origin of these scientific methods are across the science rather than scientific methods originating from the modern medicine. No,
True.
these scientific methods are used across the, for example, engineering, artificial intelligence, even the many of the researchers use these methods across the scientific communities. So I think what these methods help us is to create a level of evidence that that will help us to tell us that with authenticity that this is something that works.
Sure.
Yeah. I think the other component Manjunath sir has pointed out very nicely in terms of how do we actually combine the scientific evidence, the scientific methods along with the protocols.
Yes. Ma'am, you went out for a short while for a power
Yeah,
block.
because it's raining, so some power went off in between. So there was, I think, in the chat box, there was a question from Dr. Sharanya. She asked that when there was a arousal, how do you say that the sleep was improved? There are a couple of things that's actually very nice question raised. One is that we had one subject only because it's a pilot study. Second thing is that probably we don't know if the 24 weeks window is enough to take care, because improving the well-being is something else, and it may be a different circuit. We don't know that arousal as it is, because this subject was about 56 years. I don't consider it to be very old. So elderly population, what happens, they go to sleep early and they wake up early. So that is the thing. And in those ones, we have to tease out that factor of, the arousals, so that I think we may be able to answer this when we have some more subjects and we have their detailed EEG based, whether there was some melatonin was improved, or for the arousal, there was another circuit which was involved. So currently, I'm not able to answer, but probably by another 1 or 2 years, we may be able to have some concrete answer to your question. At this point of time, I can only say that.
So I think I'll add to what Madam has told. Right now, at least for last 10 years, we have been looking into the activations in the brain using fMRI. I'm sure at Sri Chitra also there is a lot of research that is going
Yes.
on in terms of the fMRI based studies. So one of the findings that we are commonly seeing, especially when we are designing protocols for on one side yoga and the other side the treatment as usual, we are looking at a lot of reduced activations of something called as default mode network, which is the brain networks which are more active during the resting states, especially when there is depression. Even that is one of the reasons for insomnia in patients with depression. This default mode network, which should not be active during when we are relaxed, or when this I think one of the things that we are finding, especially in the yoga arm, is this default network activation is reducing. That's where I can relate that madam's research on yoga nidra, which might be helping with the reduced activation of default mode network. So this is something that I could relate between the research findings versus madam's study.
Yeah, if I can add to what Dr. Venkata said, whenever any yoga is done, okay, so your parasympathetic drive is strengthened. For example, sleep is what? Especially during the deep non-REM sleep, during the N3 or the deep sleep, or your parasympathetic drive is the highest, which in the elderly population that N3 is reducing. It is lesser, but our subject was 56 years, so it is still not to be called as a elderly subject. So that is one thing. So when we have that subjective feeling of feeling good, so when you have body relaxes, the brain relaxes, but there may be some network that we do not know that why it is causing the arousal. There may be some breaking of networks in between. So that is we don't know exactly. So maybe in the future we may be able to answer this. One more, the next question was that what is the role of dreams in the quality of sleep? So this question is very enigmatic. But it is a very well known fact that the day we have very disturbed day and all, the content of the dream is also equally stressful. The day we have relaxed day, the content of sleep is also, because we are revisiting our activities during our dreams. But more than that, we cannot say cause and effect relationship. We are not able to say here. But dream itself is a big subject which may be explored when we have the computational power increasing. So probably that clear answer we cannot have. But yes, it's some association we can always say. Like for example, children, the day they see bad comics and those WWF fight fearful things, you see them, they are in the dreams, when they suddenly wake up, they are very frightened. So it's like a kind of a parasomnias. So but in the children, it actually, when they grow, it is all eliminated. That is why we said yoga is a lifestyle. Lifestyle means relaxing the body, relaxing the brain, no matter what happens during the day. So the brain, we try to relax the brain and the muscle, as Dr. Manjunath mentioned, that from the respiration, from cardiovascular, from musculoskeleton, from metabolic to your nervous system to your endocrine, everything in the body is interrelated. So we just try to relax our body to improve our well-being. So the dreaming, we have to find some good scientist in the future to tap that question. But yes, the question was excellent.
Arun, are you there?
Yes, sir. I have some network issue with my laptop and I'm trying to connect it from the mobile.
Sure.
Sir, as Gulia ma'am just said that it could be from it could be Yeah, are you able to hear me, sir?
Yes.
Two
yes.
times, 2 times, 2 times to 3 times.
Yeah, that's because that may be the effect of yoga, ma'am. And throughout the day, I
Not
was
a yoga, it is technology.
exactly technology. I'm using
Don't
computer.
blame yoga.
The computer and the mobile. I'm trying to connect, which is faster and net. Sorry. Yeah, ma'am. And Manjunath sir, ma'am has said already that it may be because of some neural network that is the reason we do not know. Being a physiology related, sir, my question to you is, will be able for us to find out these things effectively on time, or what sort of research has to be done for to find out such neural network for each and every procedures in yoga?
I think Narasimha would be the best person to answer because he has more hands-on experience on using these technologies. I do have used in AIMS, but the more latest one, Dr. Narasimha, would you like to first add?
Yes, sir. Some of the research that is going on is to look at the functional connectivity. So whenever there is an again, this is again the same RCT kind of a design, looking into what kind of activations happen and what kind of deactivations happen. So when the blood flows to a particular area, so during the change in the blood flow and the oxygenation in that particular area gets trapped through this functional imaging. So this functional imaging, how we do is both at a rest stage, this is called as resting state fMRI, and also there is a paradigm. For example, people see, because I'm an alcohol related researcher, so people do yoga, people do om chanting, then come and see the alcohol related cues on their screens and see how much the brain activation happens when they see alcohol related cues. First they do yoga, they come into the MRI room and they see alcohol related cues. So what is the difference between the yoga arm versus the control arm? So these are the kind of research that we do. Second is, over a period of time, we also are looking into some of the PET changes that happens, positron emission tomography changes that happens with prolonged yoga. One group does yoga for 3-4 weeks and the other group doesn't do yoga for next 3-4 weeks, and see what are the kind of changes that happens in the brain. So this is in terms of the imaging markers. In terms of the neurochemical markers, we are looking into something like BDNF. Also, we are looking into the genetic markers, epigenetic markers. So epigenetic markers at the level of uh, I was telling about the methylation, acetylation, histone deacetylation. So these are the some of the epigenetic markers that we are looking into. So what we are trying to provide evidence is in terms of providing more objective evidence with different technologies that are available, both in terms of the imaging, in terms of the neurochemical, in terms of the epigenetics. So we are bringing in more objectivity to the objectivity rather than just earlier we also used to we still continue to use the quality of life, how much the subjective rating of anxiety reduces, how much the subjective rating of depression reduces. So all those scales are also used. Along with all those scales, we are also bringing in more objective biomarkers. So this is something that we are looking at.
To add to that, even now, certain behaviors can be artificially induced as are broken by transcranial magnetic stimulation. Therefore, those things are also being used now, as Dr. Narasimha told. There are objective evidences, and there is a way of interrupting those in circuits and trying to see the effect of that. Therefore, both, yeah. Therefore, there are behavioral changes that can be induced by using these interventions, which actually supplement or actually support that yes, this network was actually active, and when we break that network, and what happens to the behavior. For some of these things, they are all evolving actually. When I was doing my MD, TMS was unknown actually. I mean, I presented a seminar on TMS and most of us didn't know what is TMS at that time. So in that way, we may have even better investigative tools coming up and which can help us in identifying all these things. I hope that answers most of the question, Arun.
Sir, we had a project in Sri Chitra on Parkinson disease and yoga related, where we used transcranial magnetic stimulation. Our paper is yet to, publish. It's on the progress. So TMS related, it would be maybe second or third. As you said, we don't have enough, not enough paper related to TMS and yoga. Maybe hardly one or two. Maybe this would be the one which we are waiting to do. And Narasimha sir, you said something very interesting, that if I do yoga, it is single case study. If my 5 family members do, it is a case series. We are in Kerala around 500 graduates, sir. How can we make that into a paper? Can you give some light on, how to, we all practice yoga, we all prescribe yoga, we all give as, our own perspective, we make a therapy sessions and prescribe yoga. And how can it be a single type model and which can be helpful by using technology?
Yeah. So again, that becomes a large case series rather than uh, so again, there are people who follow these cohorts. So for example, people follow up a cohort of
For an example,
population.
common yoga protocol which everybody follows, right, these days.
Yeah. So for example, there are people who follow up for example some villages in Japan, where there are people who are living more than 100 years. So they looked into what are the practices that they have. So this becomes a cohort. The population who are practicing yoga should become a cohort. If at all you don't wanted a comparison arm, you can make this as a cohort and follow this cohort for a longer period of time and see in terms of the outcomes in this cohort, maybe at the end of 10 years, maybe at the end of 20 years, maybe at the end of 50 years. So maybe the evidence may not be generated today or at the end of 1 year, but the evidence gets generated at the end of 5 years or 10 years. But when you are designing a cohort study, you should have your clear objective outcomes. For example, people who are practicing yoga are going to live for maybe have lesser prevalence of cardiovascular events, has lesser incident of brain events that are going to happen. So that is something that you need to mark. Also, you can also look into your brain changes over a period of time. Are you at lesser risk of developing dementia? People who practice yoga, are they at lesser risk of developing dementia? So if you are making a cohort, for example, people are working on, someone asked about COVID. So mothers who has delivered during COVID, so they started looking those children for next 10 years or 15 years in terms of whether the COVID has created any problem in those children who are born during the COVID period of time. So if you are wanting to study this 500 population, make this as a cohort. You need to have some protocols and you need to look into the outcomes, objective outcomes over a period of 5 years or 10 years. So this is how you can study. So my thoughts, I think. Manjunath sir.
Yeah, Narasimha, very apt, very, very good. Yeah, that's true. I was about to say the same thing. And today only me and Arun had discussed about Okinawa group of people in Japan or some other. So yes, the cohort studies would be very, very useful. Though you may not be able to formulate all the questions now, maybe we can formulate some questions down the lane 10 years and then retrospectively we will go back and see. Therefore, that might be possible. But as Narasimha said, best would be to follow up this cohort, 500 people who are already there. Try to identify common features that have been consistently followed. And over a period of 10 years or so, you can see what is the cumulative effect of those things. That would be really good. Yeah. Only thing is
we being a practitioners as well as training people in yoga therapy, we also get a lot of patients. And even, some people are there since last 10 years, they are doing yoga or they are coming for our sessions. Such peoples also can be used for such a cohort, right, sir? If I'm not wrong.
Narasimha?
Cohort becomes a you can make cohort based on some identifiable characteristics. For example, how you will become a cohort is that you are people who are practicing yoga on a regular basis. So,
Okay.
so identifiable features. For example, for you, people might be coming for yoga for addiction. For someone, people might be coming for sleep-related problems. For someone, they might be coming for dementia. So that cannot ideally doesn't fit into a cohort kind of a design. So you need to identify certain features. For example, you are only treating 100 patients of dementia, maybe mild cognitive impairment, and you started giving yoga, and you are looking at their outcomes at the end of 10 years or 15 years. That becomes a cohort. So, so you need to again blend it with some of these research methodologies.
Yeah, true. For an example, if I associate with you and train all the patients who is coming to you for another 10, 15 years, it become actually a cohort.
Definitely,
Just to
definitely.
get in a clarity, not,
Yeah, correct.
So you are Tejas, you are one cohort. So the people you are sending, you are another cohort. Even within you saying that 500 graduate for last 10 years. So that is one. So next is millennial. Next is that. So that is like, it's addition to the science. It's addition to the knowledge, how differently we are thinking, because our lifestyle is different. 50 years the lifestyle was different. You may have heard often from our grandparents that great grandparents that they never took even a paracetamol for a fever. The body's internal mechanism was so robust. So that way we have to think of the people every 10 years, and then make distinct cohorts with a distinct purpose.
Okay.
So the heterogeneity is reduced there, because we have a larger population, people added onto, because we have food, we have climate, there are so many factors involved. So we have to tease out and make a beautiful cohort.
True. Thank you, ma'am. Thank you, Narasimha sir and Manjunath sir. If any audience have any questions, if you can write down the chat box, or if you will enable you to ask few questions.
A couple of questions I could see was during my presentation, somebody had asked about the link to the research paper that I was discussing, and the review article that I mentioned is a good one, which you can start, but there are so many articles I can't really quote all of them. The other book, though it's a little older book, those two are reasonably good to start with, and then naturally you can develop on your own. You will be able to identify good articles on your own. There was one for Narasimha. Narasimha, they're asking about where is your book available. Is that correct?
Yes, sir. I think it's there on Amazon.
Oh, okay. Okay.
I can share the link in the group.
Sure. Yeah. One more thing. Many of you might not be knowing. The one book which Dr. Bijlani has written about understanding medical physiology, there is one section 17 on yoga. It's very, very informative, especially written from the perspective of a medical practitioner for medical students. For this textbook is available for people. If they are interested, they can also buy it from Amazon or JP Brothers. That section is really useful.
Yeah, the textbook which you are part of writing, it's 2004 one. Yeah.
Yes, correct. Yeah.
With Professor Bijlani, right, sir?
Yes, correct. Fourth edition of Understanding Medical Physiology. And that gives a lot of references also. We have taken real care, though it's a little older book now, but at that time itself, there are the references at the end of that section on yoga are really informative. I mean, and most of the work actually was done already by Dr. Bijlani. Mine was only an addition later, but it's really informative.
Yes.
Sure.
We'll go through that.
Okay.
Any other questions? Any of our participants wanted to ask questions? Please unmute and go ahead.
Good evening, sirs. Thank you very much for the beautiful presentation, ma'am, too. I have a doubt. So when Dr. Arun just mentioned about Karma Yoga, Bhakti Yoga, can't we also bring it under the research of informal yoga practices, and Hatha Yoga and Ashtanga Yoga being a little bit more scientific and protocol oriented, as formal yoga practices for a comparative study, as we do in mindfulness, where we have informal mindfulness practices and formal mindfulness practices.
You wanted to ask the questions to Manjunath sir or all of the three? All of them.
I want to check whether it is a possibility, and can we also take up a study like that in future? Because we, as Arun said, there is no enough evidence on Bhakti Yoga, Karma Yoga, because it's not a standardized protocol. Then how do we bring it into the research perspective?
Okay, if I may
Manjunath
add
sir.
here. Yeah, sure. Yeah. As I said, therefore, yoga is a very broad term, and it's very difficult to scientifically define what it means. Therefore, we have to go with the reductionist approach. Therefore, Bhakti Yoga, I don't really know what can be called as Bhakti Yoga. Karma Yoga also. Therefore, sometimes the definitions, if they are not very clear, then it is difficult to fit into a scientific paradigm. And that's where some of these informal things, which have very wide meaning, we will find it difficult to address that as a scientific question. That's what I understand. Say, for example, what is the definition of health? The definition of health is like a complete physical, mental, social, and spiritual well-being, and not merely an absence of disease or infirmity. That is actually the definition of WHO definition of health, which is very wide. How do you quantify spiritual health? No, we can't as of now. Therefore, my understanding is that whatever that can be, which can be defined precisely, can only be studied. If the definition is not precise, then at least the current tools, we are not equipped to study them. Dr. Narasimha?
Right.
Yes, sir. I think I agree with your point that maybe if you wanted to study differences, first thing that to be more precise, we need to have yoga as a picture, yoga as an overall thing, and then generate evidence for yoga compared to another way of practice. And then within that, we can subdivide into different components as a secondary part of the study. But primarily, we need to look at the whether yoga as a whole is something that is better than the other alternative. So that is something that we need to generate. And in that, we can stratify into different kinds of yoga at a second level. So the primary level, as Manjunath sir told, that we need to understand this evidence first, then the second level of evidence.
Okay, for an example, Tai Chi is another style of, way of living for Chinese or, Tibetan group. We should be comparing that and then we have to have the subdivided groups, eliminating maybe one practices.
Maybe the better would be to look at versus as a control, regular guidelines, 30 minutes of walk 5 times a day, 5 times in a week for 1 month. So this is something that is studied across disorders and has been found to be helpful. This is the evidence that has been generated over a period of time. So if we have to compare yoga, something that has been some evidence that has been already established. So we have to compare with that. Again, Tai Chi related studies also did compare with for exercise, the 30 minutes of exercise protocols is something that they have compared with. So again, if Tai Chi, I don't know the level of evidence of Tai Chi. If they have reached that level of evidence, definitely it can be compared.
Correct.
But to my understanding, the evidence is more for the 30 minutes of walking for 5 days a week.
I definitely agree with Dr. Narasimha. Yes, that's true. Already evidence, science also the evidence. We can't create evidence without there being any base. Therefore, yes, for especially with some evidence that is being, which is a general practice, that can be the comparison group to which our yoga or Tai Chi are. There are so many different ways of mindfulness, or these are mind-body interventions. Let's keep it as broad term, or they can be compared. But once we have stronger evidence with that, now we can start comparing yoga versus, say, for example, Tai Chi. That's possible.
For example, we were also talking about some of these components, right? One of the component that has been taken from yoga or part of yoga is the mindfulness component. So there is a lot of research that has been generated on specifically this component of yoga, that's the mindfulness that we generally practice during pranayama. So that is something that has a lot of evidence has been generated only on that particular component for across various disorders, starting from depression, anxiety, and OCD. So those kind of studies are there. So I think when we are the added advantage that we have is that there is a physical component also, there is a mindfulness component also, multiple components are there, and the only thing that we need to start doing is how do we put it in a adequate scientific framework so that we generate good amount of evidence.
Right. Any other questions? Any other participants?
If I can add to that,
Yes.
it's just like the EEG, EEG based. What is the message in the EEG? So it's like, the gamma waves, the high density, doing the high density EEG means putting lots of electrodes on the brain, and then to see how they are talking to each other and doing the fast Fourier transformation. So looking at the distribution of different waveforms within the EEG, how that changes in the different levels of your consciousness. So those things are being done, but it will take some time to get a clear picture. Like, for example, generally it is alpha waves relaxation. It increases because when you lie down, but then we see the ratio of the theta. Now for the cognition, we are looking into the gamma waves also. So I think sooner we will have a clarity, because we need a larger sample to be done in order to draw a conclusion. Maybe 5 subjects, 10 subjects, that number is too less. It has to be done in thousands. Then we will be able to say conclusively. For example, MRI, the same. Even to do a 50 subjects, even to do 25 subjects, it's a big challenge.
That's absolutely true, ma'am. For an especially to do MRI related studies, it takes hours together, to prepare the patients or the subjects. Ma'am,
you're
Yes, sir.
unable
Yeah.
to hear
Oh,
you.
yeah. Oh, yeah. Sorry. So these days, some of the facilities where, you can do the EEG and fMRI together. So then you have a different information. Because you can have, temporal resolution, you can have the spatial resolution, both resolution by combining these two tools, but it is not easy. So to have the larger number, it's like some of the Western world, they're too dedicated. In fact, some of the Indian, leading premier institutes, they are into it. But the patient load is so much that there is lesser time for the research.
So any other questions?
I think people are hungry. They want to go for dinner.
Ma'am, we all follow very strict dietary regimens, and we finished before 7,
I have already finished. I had, and then I came.
Ma'am, does that anything to do with the sleep? That was my forgot question to ask you. Like, if I eat at 9 o'clock, did my sleep will be disturbed? We always, all naturopathy doctors or people always ask the people to have only 2 meals, not even 3, 2 meals a day, and that to finish as early as possible at 6 or 6:30 to finish the dinner. That has something to do with the sleep. Any experience or any research based?
That is, in terms of the research, some people are started doing and writing. But from your Ayurveda and all those people, those who have been, telling. But today's era, if you look, it is all lifestyle. Because of your electronic gadgets, our people, youngsters, you go to any medical college, any IIT, you ask them what time they are sleeping. they will say 4 o'clock. That is, 5 o'clock. It's a time to wake up, but for them, so there is a conflict of the circadian rhythm with their other body systems. So this is a very complex question. Like eating, for us, we have learned this understanding, and we have, made our lifestyle in such a way that we can sleep at 10 or maybe at 11. For us, it is okay. But the youngsters who are just coming back from the office at 7 o'clock or reaching home at 11 o'clock, the lifestyle, it takes time. But it must, that is another cohort, so that youngsters who are, the shift workers, some studies are being carried on. And to see the food, of course, the food in moderation, food, lesser spicy food in the evening, those are helpful because there is not much load on the digestion and your digestive system. However, the lighter food, which you can digest easily, so that, so that your rhythm of the body, you're not very hypoglycemic. You should be, it's only your, the metabolites, they are just distributed when you are sleeping.
Okay.
So it is not a simple factor. It is a complex answer with the complex question. However, it has some relevance. It has a true relevance.
Yes, I think Narasimha sir has something to add up when you said about he raised the hand. Sir, anything? Any points?
Yeah. So this is regarding your question in terms of what is the
Time of
rationale
eating.
for eating and this thing. So after almost 20, 30 years, I think, of research, one molecule got approved for insomnia after almost 20 years or 30 years FDA approval. That is called as suvorexant. Suvorexant is an orexin receptor antagonist.
Yes.
See, orexins are I think Manjunath sir will clarify more from what I am telling. See, orexins are certain neurochemicals that gets released when you eat food, and they have a pattern in which they increase and reduce. So when you eat at a later phase, these orexin homeostasis gets disturbed because your food intake is in turn related to your orexin homeostasis. So when you take early, your orexin homeostasis gets maintained, and because of which you get a proper sleep. So this orexin receptor antagonist, basically, instead of like what you are following, one of the methods that you are following is to stabilize this orexin homeostasis. So people who cannot stabilize this orexin homeostasis, they are in turn have to take this orexin receptor antagonist to get sleep. And this orexin is again something that is related to what Madam is telling, something called as melatonin. Orexin and melatonin are something that are interrelated. So your sleep, your food intake, and the level of orexins, these three are getting connected here. Maybe Manjunath sir.
No, that's very true. And many a times when we discuss one, are you able to hear me?
Yes,
Okay.
sir.
Yes, sir.
Yeah. Mostly we think that circadian rhythm is generated in the brain, and that's the one which is regulating, which is actually not true. It is only synchronizing it. Therefore, every cell has a circadian rhythm, okay? And that is tuned to the daylight cycle. And even mitochondria have circadian rhythm, not just because mitochondria is, it's basically a biological organism. It's a bacteria originally. Therefore, in that way, every organ in the body has its own circadian rhythm, which gets synchronized through melatonin or hypothalamic hormones, or which seems to be correlated with our day-night cycle. Or in that way, even orexin or melatonin are basically a product of that. So in that way, there must be a lot of teleological reasons that we need to have food at an early time so that we can sleep well and we can synchronize all the hormones of the body. I just wanted to add that circadian rhythm is not just brain, that's all. Even liver cells have. We isolate the liver cell. We have shown that. We have seen that actually in Mayo Clinic. Actually, liver cells have their own independent circadian rhythm.
Okay.
Yes, so the internal, actually every cell has a biochemical clock. So it is only, the melatonin is only giving you the message. And the food you eat itself is a message. You
It's a
eat your
message.
food, you eat your food timely, it is a message to your body, it is a clock to your body.
True,
But one day you are disturbing the whole thing, the body is confused. That is what the white light, all these are, they are the cues which are confusing your body.
Okay. Narasimha sir, do you get any cases of video gaming, some sentences that you put in your slides, like they are gaming some disorder, which is connected with this circadian rhythm, and will any yoga techniques would help them?
Yeah, gaming disorder is something that we commonly see, and one of the main problem that the parents complaint is that like what madam was telling, that they don't sleep overnight, and their sleep gets disturbed significantly. Again, yoga standalone is not something that we do. We look into a multifactorial approach, looking into all the aspects why this person has become dependent on this internet gaming. So some of the things, like most people have social anxiety. So when they reach a level where they could not actually interact with the people, so then they find difficult to interact. Then they'll get pleasure out of other aspects, other things, like internet gaming becomes one of their uh, easily pleasurable thing. And now with prevalence of multiplayer online role play games, what happens is, instead of having a social identity, they get identity in a virtual world. So in virtual world, people cannot judge them, so they don't feel anxious in a virtual world. So that's where people go into this internet gaming. One of the reason. So there are multiple reasons. One of the reasons, like for example, you asked what is your experience. So this is my experience. This is a case report kind of an experience. So it can be multiple causes. The causes needs to be identified. But with yoga, what happens is the anxiety level to some extent comes down. So yoga becomes a part of the treatment. But otherwise, we also look into other factors in terms of the treatment protocols, especially structuring the day. So when we structure the day with a routine along with yoga, their sleep also gets improved.
Glad to hear that as well. Any other questions? If you have, please come forward. I think it's almost time. I request our General Secretary, Dr. Ansmol, to give a vote of thanks for the program and conclude our sessions.
Yeah, Dr. Arun, sorry, before we wind up, I just wanted to ask about the post-COVID question, because
Okay.
this was a recent discussion that happened. I had submitted a research paper on post-COVID anxiety and depression, and this was asked in the exam. Is there a possibility whether depression and anxiety, the tools I used was HADS, and whether it was a specific tool for post-COVID anxiety and depression, but whether that is a limitation of the study, this particular tool, using this particular tool?
The tool name is HAMD, is it?
No, it is HAD.
Hamilton.
No, HADS,
HAD.
anxiety and depression score.
Hamilton Anxiety and Depression Scale.
Hospital, yeah, hospital anxiety and depression.
Hospital. Okay. So basically, this hospital anxiety and depression scale is a screening tool rather than a diagnostic tool. So there are different kinds of tools that we generally use. For example, when you are using on a general population, like sir was telling about how many of the naturopathy practitioners or the yoga practitioners have anxiety or depression. To pick them, we use this HADS, Hospital Anxiety and Depression Scale. But in them, what is the severity of anxiety and depression? Then you have to use a rating scale. So Hamilton Depression Rating Scale, Hamilton Anxiety Rating Scale. So that needs to be used. So it again depends upon your study methodology. But what most of the COVID related research that they have used is that they have used both these tools. One, hospital anxiety and depression scale for screening. In people who are screened, they have used Hamilton Anxiety Rating Scale and Hamilton Depression Rating Scale to assess the severity. So there is no validated new scale that people have developed, to my understanding, but things might be beyond my understanding, that there might have been some people who might have developed some skills, but at least to my understanding, there are no new skills that has been validated or tested, and that may also not be required, is what is my thought. I hope I answered your question.
Yes, you did. Thank you, sir. So basically, if the study becomes more accepted or probably more scientific when there is both the tools are used, both screening and diagnostic.
Yeah, again, it depends upon your research question. What is your research question?
Mm.
What is the level of did naturopathy practitioners develop anxiety and depression during COVID-19 or not? If that is a question, then use a HADS scale on all the people. Okay. If your question is that if the naturopathy practitioners had lesser severity of anxiety and depression compared to modern medicine practitioners, then you do Hamilton depression rating scale and Hamilton anxiety rating scale.
Okay. The question was, sir, effect of yoga-based intervention on post-COVID anxiety and depression. That's all. So there was no
rating scale.
Okay. All right. Thank you.
Okay. Thank you. Dr. Ansmol, are you there?
Yes, sir. Yes, sir. So a very good evening to one and all. I'm so glad to express my vote of thanks. And a special thanks to Dr. Rajvendra Rao, the director of CCRYN. And my heart fills with lots of respect and gratitude with the doctors who, like Dr. Manjunatha S., Dr. Kamlesh K. Gaulia, Dr. Venkatalakshmi Narasimha. Thank you all for accepting our invitation and for being a part of our program. And the session was really mind-blowing. And thank you for such a great session. And I would also like to thank Dr. Dinesh Karta and Dr. Arun Tejas, the backbone of this webinar, and also all the Inygma crew members who has worked hard for this success of the program. And also, it's my matter of pride for me that I got a chance to thank each and everyone who have participated in this program, the doctors, the interns, the students. Thank you all. Thank you once again.
Thank you.
Thank you. Thank you very much, sir.
Okay, can we leave now?
Yes, sir. Yes, sir.
Okay.
Yes.
Bye, sir.
Bye.
Bye.
Bye, Narasimha.
Bye.
I'll call you later. Bye, Arun. I'll call you later.
Thank
Bye,
you,
sir.
everyone. Thank you. Thank you,
Bye,
Manju.
madam.
Thank you.
Bye, ma'am.
Thank
Thank
you,
you.
Dr.
Bye.
Kamlesh. Nice seeing you.
See you
Bye.
sometime. Bye.
Sure.
Bye.